My name is Deniz Bruce. I'm the CEO of the GMDN agency since November 2022. Can I have the next slide, please? Yes. I have 3 slides just to give a little bit of overview about the agency. For the attendees who are, just introduced to GMDN and doesn't know us, the agency's history is back to 1991. Agency has been created actually by regulators at the time as a joint effort. And at the time, it was the association GHTF, which now known as IMDRF. And from 1991 till today, agency is providing global medical device nomenclature, taking care of it, maintaining it. And most important to know, GMDN is a non-profit agency. It has a charity status in the UK. Definitely, we are not a profit organization. Next, please. As you may know, GMDN name and group all medical devices. The nomenclature has more than 25,000 terms for all medical devices, all systematically named to reduce the duplication and ambiguity around defining medical devices. As of today, we know that around 1,400 manufacturers are using GMDN. GMDN has a great, uptake, especially with the free access option, which allows anybody to have a registration and a membership with the agency. One very important thing, GMDN is representing the current supply of all medical devices. It has a dynamic nature. It's updated constantly because manufacturers are getting back to us about their innovations, about their medical devices. So it's an ongoing process, updating and keeping it maintained. It is globally recognized and it's independent as an agency, as a non-profit agency. We have around 15,000 users. 70 regulators use and refer to GMDN in any capacity, sometimes in their medical device regulatory legislation, sometimes just their own nomenclature based on GMDN. GMDN is used in more than 145 countries. We've been working with the FDA, especially for the Good ID database, since 2015. I'm sure you're all aware of that. And be reminded that it's a self-funding, independent from industry and guided by regulators. Next slide and the last one. Yes, so what we mean by that, the regulators play a great deal of role in terms of advising for the future of nomenclature agency. So as a non-profit organization, we have board of trustees and the chair is John Wilkinson. We have 2 advisory groups. The one at the right-hand side is providing strategic advice to the agency. And the members from ANVISA, FDA, Health Canada, MHRA, and TGA regularly meet with the board and provide strategic guidance. And I'm working here with the GMDN team members to serve your nomenclature needs. And today we have Ed and Tori to provide training in terms of GMDN use and answer your questions. During the training, if your question hasn't been answered, please put them on chat. We're going to get back to you, or we can have a call with you if you would like us to do. Over to you, Ed. Thanks.
Thanks, Denise. Cheers. Thank you. So this is, I've called this a primer. So this is hopefully a set of slides that will get you more familiar with the way the GMDN data is, that how to find your terms and how to manage obsolete terms, this type of thing. So we'll dive straight in. So the objectives of this training will be to help you to understand the value of the GMDN, how to find your GMDN term or terms, the difference between UDI and GMDN, which I'm sure most of you know, but we'll just go over some of those basics. Understanding data quality, some issues with data quality, some common mistakes, and also having a good process in place to manage good data quality. And by that, we mean GMDN term assignment. And also managing your account. So Tori will go through some details on managing your account within our system. So why GMDN? Good question. So many, as Denise has outlined some of the histories, and many regulators across the world require manufacturers to have the GMDN code, and you'll know this. So we, as the GMDN, we create generic device groups. So these are non-proprietary groups of devices. So this pictorial example kind of shows how we've got stethoscopes, MRI machines, all grouped together, different manufacturers, different models, all grouped in a non-proprietary way by the GMDN terms. The GMDN codes assist not only the regulators in organising their work streams and spotting trends, they also help device registries and clinical groups to review outcomes, and they help hospitals to manage both purchasing and inventory, so clinical engineering uses as well, which part is the device life cycle. So it's a really integral part to not just the regulators, but other healthcare users. So start with some basics. So UDI, unique device identification, which I'm sure you're all familiar with. So that is a unique identifier, whether it's a GS1 GTIN or a HIBIC barcode or another type of barcode that describes, that represents that device, that kind of make, model, that exact instance of that device type by a specific manufacturer. So it's converted into a barcode, the data is easily retrieved, the less mistakes. We've seen it in retail for years. It works very well. So the next, if you look on the right-hand side, you'll see as we progress. So the next step is, as I said, to name group. So these are infrared patient thermometers, comma skin, because they use the skin to take the measurement. And this is how we define that group. So it's given a code, it's given a name, and we have a GMDN term definition. It's under 700 characters to describe what we mean by that concept. And so that now groups all devices of that description in a non-proprietary way. So different manufacturers, different models within those manufacturers, all described by and represented by that term. Next, we have GMDN categories, or CTs. So these are categories, and these group GMDN terms. So in turn, they're making larger groups of devices. So the categories group the terms, and the terms group the devices. So ipso facto, the categories are also grouping devices, which is useful for downstream users. And this is arranged in a category hierarchy. We have different starting nodes, whether we're starting looking at the device function or the clinical application, or whether we're looking at the name type of the device. We've got lots of different ways to see this. And if you've used the Explorer, you'll have seen these categories, and they're a very useful way to search, which we'll come on to later. So what's the process? So the GMDN term is assigned to the device by you, the manufacturer. for regulators and hospitals to do analysis. That's the simple story. So, yeah, as Denise said, feel free to add any questions in the chat, and I'll try to pick those up as I go along. So I'll stop at these kind of turquoise screens, and I'll check for any questions, and I'll answer them as we go along. There aren't any yet, so I will proceed. So the nomenclature, so we'll look at the terms and the data structure. So this often get asked this question about how the terms are written and what methodology do we use. So the terms are non-proprietary groups, and they outline common intended use of devices, common technology for which device functions, the form of the device or the components that the device include, and after that is also a series of significant attributes such as the use frequency, inclusion of pharmaceuticals, or how it's powered. So if it's electrically powered, pneumatically powered, or manual, we'll create those distinctions within the terms. It's worth noting that if you see a term you think that could describe my device, but there's a primary feature or intended use that's not mentioned in the term, then it's possible that it's not the correct term for your product. So keep an eye out for that. It should fairly well represent your device. If there's significant information that's primary intended use based that's missing, it might be worth checking with us, and we do have an inquiry service, which I'll come on to as well. We do have a glossary, so this is under the help menu. This is a reference list. I mean, in healthcare, you'll know that there's lots of different words that could describe the same type of thing. There's lots of synonym words, bioabsorbable, biodegradable, bioresorbable, these type of things. And so we prefer to have a rationale for why we use one set of words and use that consistently. And so you could refer to this if you think that you're searching for a word and you don't see it at all. It could be because we use a different word for that description. So I mentioned on mutual exclusivity, the terms, so each device should be linked to a single GMDN term, and all the terms are mutually exclusive. So only one term should represent a device. If your device could be represented by multiple terms, and that's an issue that we need to resolve. So you can let us know. We'll take that very seriously, the mutual exclusivity. So then lots of devices can be represented by a GMDN term, but for each of those, only one term will fit that, will match that device. So edits to terms. We do make edits to the GMDN terms, and this helps us keep up with innovation, include new variations of a device, and they're variations that aren't significant enough to warrant them being collected in a different term or a different device group. But we need to include those for clarity. So the edits are intended to broaden the scope of the term in a manageable way. They're certainly not intended to narrow the scope of the term. So this would mean that if there's a good assignment to a GMDN term and we change that term, it remains a good assignment. We don't narrow it such as to exclude devices that have already been assigned. That's one of our top priorities. And you can see this graphic shows this. So the term scope increases, more device types can be included in that, but if it narrows, we excluding devices, we do not want to do that. So obsolete GMDN terms. So this is something that's, if you're registering with the FDA, this is something that's come up recently, that the FDA are interested in identifying, or can now through the public Good ID database, Access Good ID, you can see whether your assignment is public, can be visible, whether it's obsolete or not. We do make terms obsolete if it overlaps with another term, if it's creating an ineffective group, which can often happen because of the way technology has evolved. The grouping that was good 10 years ago, 5-10 years ago is no longer good, or if it just represents redundant technology and it's no longer required. Once a term has been made obsolete, it can't be reinstated as active. So that's important. We certainly can, if there is another term required to be made, we'll certainly do that, but we can't reinstate an obsolete term. You can't purchase an obsolete term, although if they're in your My Terms list, you can see them still. And you can search my obsolete terms, but you can't purchase them, so that's not particularly useful. If you've previously purchased a term and it's since been made obsolete, you'll see it marked obsolete in your My Terms list. And if you've got the right notifications set up, you will get notified of that by email or in a summary. Or you can look in your on your account and you will see that. So some regulators do insist that assignments to obsolete terms be updated to active terms within the database. I think it's right to say the FDA is one of those. So be prepared to find an active term replacement where you can. So we've got quite a few questions. I'll have a quick look at those. Okay, we've got some of these answered. Okay, thank you. Denise or Vas, if there's anything that jumps out from those questions that you think is worth mentioning, then let me know, and I'll include that in the discussion.
There is a question about how do I differentiate IVD and MD? Yeah.
Okay, so there is, all IVDs are, in the name, it does say IVD in the name. We have a separate category for IVDs that isolates the IVDs. And when you do a search, I believe you can filter by IVD and by General Medical Device, GMDN, GMD, so that would be non-IVDs. Okay, so that nicely brings on to finding the right GMDN term. So the first approach you could take, or not necessarily the best approach, but the most basic from an understanding point of view is a simple word search. So this is under search. This is called search on the website, and you can do a simple word search or part word search, and the results appear in order of relevance. So where it appears in the name, it will come up first. So if you're searching for something like electrocardiography, it could be electrocardiographic, electrocardiography. It could be different, the same root meaning, root word, but different words. So you can search a part word. So here you see monitor electrocardio, which are part words. You get electrocardiographic monitor and electrocardiography telemetric monitoring system. So you can see that it's worth bearing that in mind if you want to keep your search broad enough to include anything that you might miss. So that's a basic word search. You can also use our category Explorer. So the Explorer is the hierarchy of categories displayed, and you can start with, say, a top-down approach. So if you have, say, you've got an implants, acetabular aligners, you can start with orthopedic devices under the clinical anatomy node, and drill down to implantable joint prosthesis and associated devices, implantable joint prosthesis, implantable hip prosthesis, and acetabular aligners. And you can see there we have 4 terms there. And the codes are revealed here because in the account I took this from, these are in the list. But if you want those codes, you have to click on shortlist, and then you can buy it from your short purchase. Well, purchase is not quite the right term. You can get it from your shortlist. There is no additional cost once you're a member to getting the codes. The other approach is to find a category. So if if you go to the Find tab here on the at the top of on the left-hand side, if you type in monitoring, you'll see that cardiovascular monitoring systems is down there in as a category. And from that category, you can review the terms that are under there, and you can see the one we were looking at earlier, which is the ECG monitor. Worth bearing in mind is that for this find feature, it's searching a string of letters, so it's best to use a single word, keyword, or a part word search. If you add two words together, then you're reducing the chance of finding what you want, because of the way the name might be formatted. So we've got a question: are these the same CTs that the TGA use? And yes, that they are. They are the same, absolutely. So how do I access the category Explorer? I would just cover off on that. So that is in your membership. If you will see in the drop down, the terms drop down, you'll see Explorer should be there, and there's a start page as well, and you'll see that on the start page as well. So making an inquiry. So we do have a free application for inquiries. I'm sure some of you have made inquiries before. And this is if you can't find the right term for your device. If you submit an inquiry, we will help you find the term or help create a term if it's a novel device. So we'll help you through that process. So if we've got a wizard, so you go through, you attach the appropriate product information, we guide you through this. And the data, it's worth noting, the data that you submit is only for GMDN internal use, so we kept confidential. So there should be no concerns about this information being released to a wider public. We'll discuss with you during the drafting process, and we've got a messaging system, so you'll receive notifications of any messages through your emails, and we'll work with you to get the right resolution and the right term for you. So this is a growing topic. So identifying a replacement term for an obsolete term. So we've just launched, or launching, it's probably the best word, so we're making improvements as we go, a new alternative term finder tool. So if you go to your My Terms page and select the obsolete terms in your list, so these are the codes that you might have used and submitted that are now obsolete, and you'll see the terms that you have that have been made obsolete. If you click on the details for that term, for a term, you'll see in that details page, you'll see alternative suggested terms. So these are just suggestions. They're the best suggestions we can make, and we've gone through to try and give the best suggestion of what would be alternatives for that now obsoleted term. But it could be that the term you need is not in that list. That could very well be the case. We also have categories in the title Explorer groups. These categories are the categories associated with that obsolete term, and although the term is obsolete, they're kept up to date with any new categories. So if you want to find a replacement, you can use those category links to find the alternative term. So if you click on those links, they go straight to the Explorer, and you'll see where you are there, and you can navigate through that to find the terms. Or you could simply search the database. So start again and search from scratch if you so wish, if none of that happens to be useful. So I've done some screen grabs so you can see that process. So for example, here we have an account, we have this obsolete term here that we want to find a replacement for. So you click on the details, and under details we have the reason for obsolescence, or or if it's a modification, in this case it's an obsolescence. So the term has been made obsolete as part of a substantial review, and etc. So if you want to know why, you can find out why there. We have the alternative suggested terms here, and we also have a list of the categories associated with that obsolete term, which will then those categories will obviously house any active terms that, as well as the obsolete terms. So house the active terms that may be a good alternative for what you need. So you click on these highlighting these categories, and they are hyperlinks to the Explorer. Sorry. Okay, do we have any questions that we think we should cover off on? If one of my products becomes discontinued, do I need to have it removed from the GMDN database? So no, I mean, there's no product. We don't collect product data on our GMDN database. It's only our terms. How do we create a new GMDN code for the device? How do we modify existing GMDN code? What's the process? So if you want to have a new term created, you follow that. You make an inquiry with us. The inquiry process I mentioned, and that's how we'll make sure that your device is covered. And if it's a novel device, that might require a new term. Are GMDN and EMDN mapped? Well, that's kind of a bigger question, and we can certainly follow up on that at some time. There has been some mapping activities. It's not a simple answer to that. Mapping is quite complicated, and there are certainly some challenges with that. So we certainly can cover off that and extend some information to you on that if you want to contact us. Probably beyond the scope of this training. Is there a rule of thumb on how many years we should go without checking obsoleted terms? That is a good question. We'll come on to that later. Very good question. I like that. I will continue for the sake of time, but it's got some really good questions coming in. So, assignment data quality. So this is the golden rule, really. So every device placed on the market separately, so with its own UDI, in a UDI world, should be assigned a single GMDN term that accurately represents that device. So we'll talk about systems. So only products that exist as a system at the point of sale should be assigned to a GMDN term describing a system. So if you have, so this is a mock-up of a hypothetical system. So that if that's all covered by a single barcode, a single UDI, then that represents a whole system that can be assigned to a GMDN term for a system that describes that. If you have system components that are sold separately with their own UDIs, they should not be assigned to the term for the system. They would need their own GMDN term that describes that component of that system. So, for example, it could be an electrical cable. We have quite generic terms for electrical cable, whereas it could be electrical cable that's part of a quite dedicated system, but given the nature of electrical cables, we would be quite generic. So that shouldn't be assigned to the term for the system. So we're looking to group in this kind of way, where we have all system components, say, taking an MRI system, the MRI system table, the synchronizer, the coils, or the full system itself, grouped by the system term there, all in their own generic device groups, represented by these GMDN terms. So that's how we want to group. What we want to avoid is the use of the system term as a catch-all to collect all systems and their components. So we really want to avoid that, and that is something that we see quite commonly. So that's something to be careful of. The same logic then extends to accessories of a primary device. So if there's a device designed to support a parent device, if it's sold separately, it should also be assigned its own GMDN term. So if you take the example of a crutch, that's the term for a crutch, the auxiliary crutch, and that's a good assignment. The crutch pad, so these pads should be assigned to the term for the crutch pad. Right. What we don't want is the crutch pad to be assigned to the term for the parent device of the auxiliary crutch. So that's a bad assignment. So the question we had about how often we should look at obsolete terms, we have produced a code of good practice for you guys. And this, I'll go through this, and this will outline how we suggest you best manage your GMDN assignments, including obsolete terms. So ideally, you want to have a global approach to nomenclature within your organization. So you want, by that, you want to have only a single GMDN account for your organization, rather than having each user create their own accounts. You want to try and identify who's responsible for GMDN within your organization, so they can be the kind of primary contact. We do have lots of user permissions within the accounts, which Tori can cover off, or will cover off on, I believe. And so these permissions can be set up for each individual, so they can do what they need to do, but no more, so there's no confusion. And there's a variety of notification options we provide. So set those to what fits you. If you don't want to get bombarded by emails, then don't use that. If you find that very useful, you can set email notifications. So it would be good to encourage all the staff to do training on GMDN, such as this, and we have online training, and promote good practice. If you have inquiries, if you want to send in an inquiry because you need the term for your device, it's a novel device, please send them in good time, because we get very busy with inquiries, and we don't want to have we don't want you in a situation where we're slowing you down in your regulatory process. And stay in touch. So this is our SOP, and this is our flow diagram. This isn't the whole thing. I'll work through it bit by bit. So you have a new device on the market. So you'll start your GMDN assignment process. So you go to the GMDN database, you register to become a member, and then the question is, have you found a suitable GMDN term? So use the tools I've shown to search the database, and if you can find the term, great, assign the term to GMDN, assign the GMDN term to that device in your master data record, and that gets submitted to any UDI systems. And then you've got no immediate actions, but you will set a date for a follow-up review of that GMDN assignment. So whether or not it could be a good assignment, it could be considered a good assignment, but time might go by and there might be some intended use tweaks, or you might find that the GMDN term has been edited and you want to check whether that edit is we've done things properly, and whether that's a good edit that still includes your device, or whether someone's left, or that maybe the training's improved and you want to check that's still a good assignment. So set a date for that, and we won't tell you how long to wait to review an assignment, but you know, if there's no other actions, it could be a few months or so. It's completely up to you, but what you think is right. So then the next thing that could happen is, what happens if I manage, how do I manage an obsolescence? So on the top right here, it's the same flow diagram, but here we've got the GMDN notifies of the term obsolescence. So you go through the same process essentially again. We do have tools now that I showed for finding alternative terms more readily and more easily in the term details page. And you can use those, but essentially in a broader sense, that's still searching the GMDN database. And you still might find yourself that in a situation where you can't find a suitable GMDN term for that device. So if you can, great, go through that. If you can't, then please submit an inquiry. So online inquiry to GMDN, we'll communicate with you and make sure within the best time frame we get you the GMDN term you need. So the next part I want to discuss is managing feedback. So this is something to look out for. So you've got your assignment, we've got our assignment made, and it's in your master data record. You had no immediate actions, you've set a date for review. So the next thing that can happen is you set that date, and that date comes, and so you want an internal review of the GMDN assignments. And so then the question is that GMDN assignment still correct? And if the answer is yes, no immediate actions. If no, you go back to the search process, looking on the website, use all the tools we've got and that I've described. And if you can't find another term, you can submit an inquiry as before. So it's the same process. Additionally to that data gets submitted to a UDI database, and then there's a growing number of public access sites to that master data, that regulatory master data, and a stakeholder might get in touch with you or a hospital to say this assignment isn't good, or we don't think it's a good assignment, or they want to question it. So then the same process will happen. Is the GMDN term assignment correct? If it is, then you can discuss with them. So no, that is a good assignment, and then no immediate actions, and it flows through again. If not, the same process to try and find an alternative term. Additionally, we might get in touch to say that we've spotted an assignment that isn't quite right, that we don't think is quite right, and then if you then have that question there to, is this a good assignment? So you can reply to us to say, no, we think it is a good assignment, and we can discuss that. Or if we spotted it's not a good assignment, we suggest you go ahead and find a good alternative, and we can help you with that process. And we've always got that inquiry option if you're getting stuck. So, okay, on to the next slide. So, done fairly well for time. Managing your account. Tori, do you want to talk about managing your account? Is there any questions we want to cover off on Denise or Vas? Is there anything that you think has stood out as worth a mention?
I'm checking the chat. We're trying to answer as we go.
Yeah.
I think
we have
yes,
we have another EMDN related question. So Magda is asking, if I have an EMDN code obtained from a GMDN code, is it necessary to continue with my GMDN codes? What happens when the correspondence of the GMDN is not exact to the EMDN?
Okay, so the correspondence between GMDN and EMDN isn't exact. It can't be exact. Two different systems approaching grouping devices in a different way. It sometimes can be about apples and pears. So it isn't exact. We do have a tool that you can use if you have your GMDN code. We have a tool in your in the account where you can click on the EMDN tab, and that can tell you what it's like a lookup where it shows what we think might be useful EMDN terms to consider. This is not as saying that this is absolutely the right EMDN term. It's just a useful lookup. So, as a GMDN, we want to provide manufacturers with a global solution to medical device nomenclature. Given that EMDN also exists, the best thing we can do is this lookup as a way to help you, at least, if even if we're not providing the actual nomenclature for that European use. So you can try that. The question, I suppose, we can have custom-made GMDN terms, so it will be not put online. So no, there's no such thing as, the only thing that custom-made wise is we do describe custom-made devices, but there's no such thing as a custom-made GMDN term. So the GMDN terms are all for everyone to see, and there's no kind of GMDN term that's just yours. That does not exist. These are generic device groupers to group devices from different manufacturers, and that is the intention of GMDN. It's not to be proprietary in any way. Okay, Tori, do you want to, I think this is yours. Do you want to proceed?
Yeah, thanks, Ed. Yeah, I'm going to need to share my screen in a little while. Thanks. So I'm Tori. I'm one half of the admin team at GMDN. So when you contact GMDN through the orders email address, it'll be myself or Caroline that answers your questions and your emails. And because of this, we just thought it'd be worth running through sort of managing your account while you're here. And the topics that I want to kind of cover are basically taken from the emails that we get that are sort of the common questions. So we thought that would be helpful for you. So I just want to start with keeping your details up to date. So I just want to share my screen. Let me just see if I can do that. Yeah, thanks, Ed. Just a sec. Okay, so you just move this that way. So this is what you would tend to see when you log into your account. Now, everything is sort of managed through here, the top right-hand corner. So first of all, I think it's really important is to keep your details up to date. So in here, you've got your profile details. Okay, so just make sure everything there is correct. And when you've got your email address here, it doesn't say it here, but on yours, it will have it'll have a green tick and it'll have verified email address. And that's really important. And if you change your email address, then you're going to need to go through the process of verifying it again. And once you change your email and you save it at the bottom here, the system will send a link to you automatically for you to actually confirm that it is you and verify your email address. But there is only a 24-hour window on that. So if you don't get to that email in time, you can come back in here to my profile and you can click this button down here to confirm your email. That'll send you another link out just to do that. So once you've verified, then you can access the database is fine. When you first become a member, these are the boxes that Ed spoke about earlier. They're not ticked. It's worth ticking if they're worth ticking if you feel that you do need reminders and notifications about changes, because unless you're actually in your membership a lot, then you're not going to necessarily know if there are any changes with your purchase terms, with your any notifications about your account. Maybe it's about to expire, that sort of thing. And then also if you're interested in having the news monthly of GMDN and anything we feel that is relevant to tell you, we would let you know. So it is worth ticking, but if you change your mind and you think actually that's not what I want, then you can always unclick. You can always sort of take the ticks away. So that's in my profile. Okay, so also while we're talking about details being updated, if you keep your organizational details changed here. We get a lot of people asking that, you've got a new address, how do you change it so that it shows up on the invoice correctly? Well, this is here, you can change it all here. It's all the information. You can add your VAT number if you need to. This actually is if your company name is going to be displayed on our members page, then tick here. This is useful if you think that there may be other members, other colleagues from within your company that want to have a membership. They can have a look then and see if there's already a company membership already active. And then obviously billing, you want that address on your email, so you tick there. So the other thing that comes up a lot is about people don't realize that you have to renew your membership each year to keep it active. So you can renew your membership up to 6 months prior to the expiry date. And if you renew it earlier, it's not going to renew at the date you renew. It will still renew at the date it's due to expire. It'll only renew at the date you make the changes if you've already expired. So what you would do to renew your membership, again, you go into the top here and choose orders. You click on buy membership. And just check that you've got the right band. These do change obviously as years go by. So just make sure you've got the right band here. You can select it from this drop down arrow. Make sure you've got the right currency. We've got euros, GBP, US dollars. and make sure that you've chosen the right method here. If you whichever one you choose, so if you want to do invoice, you click next. They will both come back up to the terms and conditions. You just need to accept this, and then it takes you into the next screen. Click finish, it'll take you into the next screen where you can either access the WorldPay to pay by credit card, or you can download your invoice. Okay, so that's where your renewals. Also, it's worth knowing that if you are, say you've started the process of renewing, or maybe you've put in a quote and you need to access that transaction that you've set up, you go back into that orders section and you look for it. I mean, if it's a new one, it'll be the top one probably, or at least the top couple, and you just find, let me just find one that's well, if you've paid it, for example, if you've paid on a credit card and you want a receipt, while I'm here I might as well say this, just click view, it'll take you back into the transaction and you can click receipt down here, because you will get a WorldPay receipt sent to you once you've completed the transaction there. But if you need for your accounts department an actual receipt from GMDN, then this is where you get it. But to access to re-access anything, you just click in the view and you can get back in. Rather than starting another transaction, just click view and it will take you back into that. So the next thing I just wanted to talk to you about is code credits, because we get a lot of questions about that. If you run out of code credits, or you know that you need to download more codes than you've got code credits available, then you need to ask for some more. So first of all, if I look here in alerts, I can see how many, well, it's got lots of information. It's got your account expires, but I can see how many code credits I've got remaining here. But if, say, I've got one code credit left and I want some more, literally click on the get code credits. You select your 50. It's free, there's no charge, so click finish, and what that does is it sends us a transaction or a notification just to say you've requested more code credits, please upload them. Now, code credits are free, but if you go over, let me just show you. So this shows how many code credits you get within each of the different levels. So say you were a manufacturer up to 500,000, you get 125 code credits for free. But if you need more than that, then you will need to upgrade to the next level. Okay. And if you needed to do that and you needed to upgrade, then you would go back in up here to orders. You'd go to your buy membership. And you change this here. So you'd go to the 2 million. Okay, and then you'd follow it through like we discussed before. Okay, now next thing I wanted to talk to you about was adding users. So quite often we get more than one user for a company and they want to start up a new membership, but obviously it's ideal if you've got a company and you need quite a few users on it. We just want you to all be on the main account. So only those with the permissions to add users will be able to do this, and I'll show you what I mean. So if you set the account up, you will have all the permissions. So you would go in, you go to users, and then you'd add a new user. If you haven't got any remaining user credits, just ask for some more. You can ask for as many as you like. Again, it will send myself and Caroline a message, and we will then upload what you want, how many you want. So when you add a new user, obviously fill in the details. And this is the permission bit that Ed was talking about. You need to have the permission of terms to be able to actually download terms from the database. So you can give the person you're adding all of the permissions, or just some of them. So you can just take off whatever. But if somebody doesn't have any of them at all, then they can access the database, but they just can't do anything. So the default setting will just be that they can look at terms and everything, but they can't do anything else. They can't download them. They can't add users or anything like that. So this is where you add those users, and then you'd save it. This, as soon as you put this email address in here, the system will then send the person that you're adding a little link. That's that link that we were talking about to verify their email address. They can't get in until they verified it. And if they come back to you and say, oh, I didn't get to the link in time, then you can send another link here on the confirm email. Or if you can't do that, just let us know and we can do it as well. So that's no problem. And I just wanted to go back to the alerts just to say this is where you kind of want to, if you want to look quickly, if you're in your account, it just gives you information about user credits, your code credits, how many days expiring, and it's got all your terms in here as well that you've downloaded. But as Ed said, if you want it in more of a list format, you just go into my terms and it's all here as well. And then you can export it into a spreadsheet if you'd like to. And then lastly, just quickly, if you phone up, we'll ask you for your manufacturer, your membership number, or if you need to identify yourself in an email to us, if you could put your membership number in, that would be great. You find that under membership and it's here. This is your membership number. So that's how we can identify you. We either use this or your email address, but it's easy to then to put in your actual membership number. So as I said, everything to look after your account is all up here, all in this section. I think that's kind of about it really. But if there's any questions after now, after the session, then just email in on the orders at GMDN agency, and Caroline and I will do our best to answer your questions. But if there's any questions now, I can answer those. I'll just check. All clear. Oh, thank you. Okay, so that's me done.
Great. Yeah, that's it. I mean, is there any other questions? I suppose the only other thing we could do is just from the perspective of what we discussed about the Explorer, it might be worth just showing you, for people who haven't used the Explorer, showing you where that is. So if you go to terms, you have the search here. We have that search, and then here we've got Explorer. So this is the tool for finding your devices. Say if I was looking for a stent, I might put stent here, and then that would find all the categories of stents we have. So maybe I'm interested in a biliary stent, and that's there under gastrointestinal stents, and they're the terms there. So find the terms I want, or maybe from that list I was interested in well, we could say, well, stents more generally, the broad term of stents, and then we've got all these types of stents, cardiovascular, non-vascular stents, got vascular stents, so coronary artery stents, drug-eluting coronary artery stents. So you can see some of the categories appear in different places. So sometimes the same category appears in multiple places, but you can see the terms there, and you can just drop down and see the definition, check that's the right one for you, and shortlist that. Then from your shortlist, you can then get the code with one of your credits, and then that will appear in your My Terms list. And as I mentioned, you can look at the obsolete ones and see the details of how to find a replacement. Alternative terms here, suggested alternatives, and these categories here. So if I click on one of these, so okay, well, this is obsolete, but I need what my device is a peripheral nerve anesthesia set. Actually, it's a catheter with some of the stuff. So I click there, and that will go back to the Explorer, and I'll be exactly in the right place to review other terms. These are all active terms, and I might say, well, I'm interested in that one. So yeah, I hope that's useful. I'll stop sharing now. So yes, any more questions? If you've got any questions,
just
put them in, or you can speak up. Carry on, Vas.
Yeah, there were a couple of very good points in the chat. So here Torsten is asking if it's possible to of solutions because they are linked to many documents, and it's a bit of a problem for the codes to be renewed, to be updated in the documents. So I believe this is something that we have been thinking about, isn't it?
Yes, absolutely. And ideally from a GMDN perspective, we don't want the GMDN to be used. We don't want GMDN codes to be put on paper documents or PDFs. That's not the best use of the GMDN term, but we know that it does exist in that kind of setting. We know there's certificates of free sale and whatnot. So that's what we're having to move towards. So working with regulators, so those issues become less going forward. But then there is there's still the issue that you guys want as long as possible to find the GMDN terms, and we are working on ways where we can give you better notification of upcoming changes. So bear with us with that, but yes, we appreciate that feedback.
And also to get the notifications, as Tori mentioned, please, do tick that box so the emails can get to you. Because of the GDPR, if you don't tick those boxes, we cannot send you anything. That's also as a reminder.
Yeah. Okay.
Do we have time for another quick one?
Yes, yeah, we do.
So here Nancy is making another point about the FDA pro codes, that sometimes, if I'm not mistaken, the same pro code, the same product code in FDA is assigned to the main component and the spare part, but for the GMDN codes, it's not the same, right?
Absolutely, that's a really good point. Yeah, thanks for bringing that up. So I think that's where a lot of the misconception comes, is that the pro codes do have that association link. The GMDN terms aren't to be used in that way. So the term for the component should be assigned to the component, and the component should be assigned to the parent device term. So they are different from the pro codes in that way. Yes. And another point on pro codes is the verbiage of the pro code does not need to necessarily align exactly with the GMDN code. We sometimes get asked that question. They're two separate categorization tools, and they're not exactly, they're going to approach it in exactly the same way. Okay. Well, thanks very much, everyone. Thanks for attending, such good attendance. Hopefully this has been really useful for you guys. If you've got any questions at all, please do not hesitate to contact us. And if there's anything you didn't understand or wasn't quite clear or you want to clarify, please don't hesitate to contact us at all. So yeah, really, thanks very much for attending.